Good evening, everyone. I am Rajshekar. Today I am going to present a seminar on septic shock. Septic shock is one of the most serious medical emergencies. It is the most severe form of sepsis and is associated with very high mortality if not treated early. It develops when the body's response to infection becomes uncontrolled, leading to circulatory failure and tissue perfusion and multiple organ dysfunction. In this seminar, I will discuss the definition, causes, pathogenesis, clinical features, investigation, and management. First, let us see the definition. First, septic shock is a subset of sepsis in which there is a profound circulatory and metabolic dysfunction. The patient develops persistent hypotension despite adequate fluid resuscitation. Because fluid alone cannot maintain blood pressure, vasopressors are required to maintain a mean arterial pressure. Another important diagnostic feature is serum lactate greater than 2 millimole per liter, indicating tissue hypoperfusion. Okay, then let us see the causes. The commonest cause is bacterial infection among gram-negative bacteria such as E. coli, Klebsiella, Pseudomonas releases endotoxin. Gram-positive bacteria such as Staphylococcus aureus and Streptococcus produces exotoxin. Fungal infections, especially Candida, can also cause septic shock, particularly in immunocompromised patients. Common sources of infection include pneumonia, UTI, and intra-abdominal infection. Now I will explain the pathogenesis, which is the most important part. The process begins with an infection. The microorganism releases toxins such as endotoxin or endotoxin. Uh, these toxins activate immune cells like macrophages and neutrophils. These immune cells releases inflammatory cytokines, mainly tumor necrotizing factor alpha and interleukins 1, interleukin 6. These cytokines produces widespread inflammation. As a result, first there is a vasodilation causes systemic uh, first vasodilation will occur, um, causing systemic vascular resistance to decrease. Second, there is a increased capillary permeability, allowing plasma to leak into tissues. These causes a reduction in circulating blood volume. Both these mechanisms result in hypotension. Because blood pressure falls, organs receive inadequate oxygen and nutrition, leading to tissue hypoperfusion. Cells shift from aerobic to anaerobic metabolism, producing excess lactic acid, resulting in lactic acidosis. Finally, prolonged hypoperfusion causes dysfunction of multiple organs such as kidney, lungs, liver, brain, and heart. This stage is called multiple organ dysfunction syndrome. If treatment is delayed, septic shock may ultimately lead to death. Next, let us see the clinical features. Patient with septic shock present with the several clinical features. They may have fever, sometimes hypothermia, tachycardia due to compensatory sympathetic stimulation, tachypnea, then persistent hypotension despite fluids, oliguria due to reduced renal perfusion, altered sensorium such as confusion or unconsciousness because of reduced cerebral perfusion, elevated serum lactate indicating tissue hypoxia, These patients usually appear very sick, require immediate ICU management. Next, the investigations. The investigations help confirm the diagnosis and assess organ damage. Important investigations include complete blood count, which may show leukocytosis or leukopenia. Blood cultures taken before starting antibiotics help to identify the positive organisms whichever are there. Maybe is gram-negative bacteria, so E. coli, Klebsiella. These are gram-positive bacteria like Staphylococcus and Streptococcus, like this. Then serum lactate measures tissue hypoperfusion. CPR and procalcitonin are inflammatory markers useful in bacterial infection. Renal function test and liver function test assess organ dysfunction. Arterial blood gas analysis detects metabolic acidosis and oxygen status. Imaging such as chest X-ray, ultrasound or CT scan helps identify the source of infection. Then management of septic shock should begin immediately. The first step is obtaining blood cultures before antibiotics, whenever possible. Next, administer broad spectrum of uh, broad, broad spectrum intravenous antibiotics within 1 hour, because early antibiotic therapy significantly improves survival. Fl- Fluid resuscitation should be started using intravenous cysteroids at 3 milliliters per kilogram. If hypotension persists after fluids, noradrenaline, also called norepinephrine, is the first line vasopressor used to maintain mean arterial pressure above 65 mmHg. Provide oxygen therapy or mechanical ventilation if required. Finally, identify and control the source of infection. For example, drain an abscess, remove an infected catheter, perform surgery if needed. Early, early recognition, the prompt management greatly improve the patient outcomes. Now see the complications. Complications if septic shock is not treated promptly, several serious complications may occur. These include acute kidney injury due to poor renal perfusion, acute respiratory distress syndrome affecting the lungs, disseminated intravascular coagulation leading to bleeding and thrombosis, multiple organ dysfunction syndrome involving failure of several organs. Ultimately, it can result in death. Prognosis. The prognosis develops on early diagnosis and timely treatment. If recognized early and treated aggressively, many patients recover. However, the mortality remains high, approximately 30 to 50%. Therefore, rapid diagnosis, early antibiotics, fluid resuscitation, vasopressors, and source control are key factors that improve survival. Septic shock is a life-threatening medical emergency caused by a dysregulated response to infection. It results in severe hypotension, tissue hyperperfusion, and multiple organ dysfunction. It results in severe Early diagnosis, prompt antibiotic therapy, adequate fluid resuscitation, vasopressors, and infection source control are the uh, cornerstones of a successful treatment. Thank you for your attention. This is my topic. Thank you.